400 million.
So that's Imperial's capital that they require off.
That's just the Imperial.
Yes, the total for North West London is over £1 billion, and one of the things we are absolutely focused on is this has to be an investment in GP services and out-of-hospital capital and the local hospitals as well as the major hospitals. It would be wrong if, having consulted the public on a big shift of services into the community, if the only business case is that we present are for the big hospitals, when actually we know that there's a lot of investment needed in the infrastructure closer to people's homes.
Excuse me, are we going to have a two-tier system which the ones what can't pay will have to get health insurance, and no health insurance is going to insure people who've got illnesses already? So where do we stand? Where does the normal people like us stand?
Sorry, yeah.
That is frightening, because not being funny, you're not going to get any medical insurance, so where's it going to leave the likes of me and other people in the same position? We're going to have ones what can afford to pay and people what can't. This is wrong.
Okay, no, sorry. Thanks for that comment. Joe.
Can I just ask a question of Imperial, if I may? It was a very interesting document, not uncontroversial. I was a little bit disappointed to see you didn't mention one of the other landowners on the Charing Cross site, which of course is Arthritis Research UK. I did check with our Chief Financial Officer. I said maybe that means you're not cashing the £500,000 a year we send Imperial College and Imperial Healthcare Trust for teaching, research and fellowships, but apparently you are cashing that. So could I ask that you engage with the charity to make sure that we've got, joined up thinking in terms of the future of the Charing Cross site, whatever that may be.
Thanks for that comment. We've actually got a number of stakeholders that we know on that site, and we will be engaging with all of them as we get a little bit further down the track. We've been waiting to finalise the IMBC to know that those plans are the plans that will end up being submitted to NHS England and to the TDA. Once that's been confirmed, then we would like to start engaging with all the stakeholders on that site, and that would be one of those groups.
We'll keep the money flowing then, good. And one associated point, but I think it is important, one of the issues, and it's a big issue in the health service, sadly, particularly at consultant level, is harassment and bullying. And I'm going to break tradition and say something positive, in that I have a number of constituents who work in Imperial, and I think since the new regime has started with Dr. Patton and Dr. Harrison, there has been a marked change in the attitude of the management of Imperial towards that level of behaviour, which is extremely distressing for those members of staff, particularly junior members of staff, be they nurses or junior doctors. And I understand that you've not shied away from making high-profile suspensions and making the point that there are behavioural standards for all people in the hospital. So you are to be congratulated on that.
I think it's a really important point that you make, and Chris might like to make some comments too, but obviously the culture of an organisation I think is essential, and to improve the staff engagement, it was something we spoke about at our last public board meeting. That is something that we are really giving a lot of focus on. We know that as staff engagement improves, patient experience improves in an organisation, so it's something we take incredibly seriously. And also I think it's really important that everyone is treated equally, everyone is treated fairly, and it shouldn't be a matter of which position you hold within an organisation. So it's something that I've taken very seriously, and something that Chris has also taken very seriously.
I mean, obviously, Joe, I can't comment on the individual cases, but I think you and
I didn't name them, and I wouldn't expect
you and I know what's being said. I agree with that. I'm clear it's an issue which we need to take very seriously. We need to lead from the top on, and it's something that is dear to my heart, and I will ensure that we do whatever we can